All right. Thank you, everyone, for joining us for our STD PHCD recipient call. We have an agenda with several things on it, several different topics, so we'll want to get into it right away. And I can advance my slides. There we go. We'll be reviewing the DIS workforce budget submission, which, I sent something earlier today on that. And then the main part of our work today will be to introduce our new TA providers, and that's JSI and Nish at Child Trends. And so we'll be hearing from both of them, and we'll do a little bit of interactive work as well. Thanks everyone for joining, and let's jump in. So there will be no budget submission for 12/31/23, and I just want to acknowledge that a lot of work went into preparing those, and I'm sure some people were already finished. And now we have changed directions, and I heartily apologize for that. Sometimes when you get nearer a thing, things get clearer, and that happened to us. And unfortunately, it didn't come clear early enough. But there is no budget that is required for 12/31/23. And further, if you are just continuing approved activities, you don't have to submit anything. There is no need to submit. You just continue with expanded authority, and you're fine. If you are proposing new activities, if you are proposing new activities or moving more than 25% of your funds, then you will need to submit a budget eventually. Now, it won't be until January 31st of 24 that we would need that. And the budget period is simply a year. It's straightforward. It's February 1st of 24 through January 31st of 25. And you would need to upload that as a grant note in Grant Solutions and include a cover letter signed by the principal investigator and authorizing official and describing the new activities that are in your budget. So please highlight those in the submission, in the cover letter. And the slides will not advance there. I did want to let you know that there is a high level of scrutiny on these funds, on the COVID funds, and new proposed activities will undergo quite a bit of review. So make sure that those that if you are proposing a change, that you've justified it and rooted it in the DIS workforce supplement guidance and the conditions of that award, which is focused on the hiring, training, and retention of DIS. So if you have any questions, you can consult your project officer. You can also reach out to me. You can reach out to both of us. That's fine, and we'll attempt to answer your questions. So we'll take a little time for discussion before we move into introducing the TA providers. And I already am a little bit stumped by this. Does a change in contractor make a difference if the scope of work stays the same? And I'm going to have to get back to you on that, Elizabeth. I want to check with OGS to make sure that that's Kenya.
Hi everyone. I would just say that a change in contractor would still be
Right.
Yeah, it would still be considered a prior approval request. So you would submit a change in contractor prior approval amendment. But Elizabeth, we can discuss that offline as well.
And then I see chat. Oh, struggling to keep up with the chat here. You can unmute yourself and ask your question verbally too, but no, the 131.24 budget would be an entire budget for the year, highlighting the new activities. Chris Turnier, also within scope, activities that improve GIS outcomes. Yes, yes. But linked to those improving DIS outcomes is important. Dustin, what amount should we be using as the budget amount? I think I'm going to have to get back to you on that, Dustin. Yeah, I'll have to get back to you. So,
hi, Jeff.
Yes.
This is Stacy. When I had the same question, my staff, Rachel from New York State and Beth, we were trying to figure out, because we've been trying to submit our carryover budget for so long. And then we got it rejected a couple of times because of new guidance, new budget changes and everything. And we were just about to submit our balance of our COVID grant for the 2 years. So now we're not sure which amount we should be submitting for this 1 year budget, because we do have a new item.
Well, the budget amount should be whatever you're going to spend in that year.
Okay.
So whatever you plan to spend in that year should be the budget amount.
Okay.
And I invite Christy, I understand you're on the call. If you have anything to add, please don't hesitate to jump in. So the amount should be the amount that you plan to spend in the year, which it could be several years worth of funds that you're looking to incorporate into 1 year of spending. Greta.
Hey, Jeff. So the original budget guidance had come down, had asked us to go out until January 31st of 2026, which was a little nerve-wracking for me because I don't have enough money to get to January of 2026. I might just have enough to get to January of 2025. If next year, for example, that we continue out, is there going to be opportunity for programs that might be like myself, that they're not going to have sufficient funding to be able to request funds to continue activities? Or should I really be trying to wrap everything up and let people go by January 31st of 2025?
Well, that's really hard to answer right now. We don't have extra funds available. You can always put in a recipient initiated request, but at this time we don't expect to have funds to be able to award in a year's time.
Sorry, Jeff, this is Stacy again. I just want to follow up on her question. So if we do the 1 year spending for this year, because we did a budget out for 2 years through 1/31/26 and able to keep the staff on, will we have the rest of that balance for the following year?
Yes.
Okay. All right.
Yes.
Okay.
But Peached is still going to go to January 31st of 2026. And as long as you have funds available, you can spend those funds through that time.
Okay.
Allison?
Yeah, thanks, Jeff. So we already submitted a budget I think everybody did, through January 31st, 2025. And we are still awaiting the new notice of award
Yes.
that will, our state needs that to release any funds that are unspent after that date. Can
Okay.
you tell us what your expected timeline is for that, so that those funds can get out to our local community partners?
I don't unfortunately have a date for you. I know we've been working on it very hard. You know, it's difficult under the CR to get the amount right and everything. I have a feeling it might be after the holidays, but it would be shortly after the holidays if it is after.
So it
And
sounds
there's
like
still a chance it might happen in December.
Okay, so you do though expect it to come out and be available before January
Yes,
31st,
before
2024?
January 31st. Yes.
Okay.
Yes, it will
Okay.
be out before January 31st. I'm quite sure of that.
Okay, thank you so much. Appreciate it.
Okay, I see some seconds that you need updated NOA. Yeah, we expect that to be coming out well before January 31st of 2024. So
Is that the peach base we're talking about, the 12-month that we just had, the year
yes,
6?
yes,
Okay,
they're talking
thank you.
about the notice of award for Peached Core or base that you applied for back in, I guess it was October, I think. Yeah.
Thank you, Jeff.
Because at this point, what I've heard you say is we can use any unspent money if states have them through the entire Peached approved budget period. And so right now that approved budget period is hopefully going to be January 31st, 2025. I know that there's a director's letter that says the intent is to extend this to 2026.
The next NOA is only going to take it through January 31st of 2025.
Right. Okay. And
then we'll be doing this again next year, hopefully with a little less miscommunication. And we'll take it from there. Any other questions? I can't see if there are hands raised. Okay. Okay, so I think we can move on. I just want to say again that we're really sorry that we ended up in this unfortunate position. As I said, the nearer it gets, the clearer it gets, and that's the situation that we found ourselves in this time, where we thought that budget could serve for your budget for the rest of the period, but it's not going to work that way. And so we're trying to undo as much burden as we can. So thank
Jeff,
you.
I'm sorry, I just have one more question. This is Stacy
Okay.
from New York. My director wanted me to ask, new activity, does that mean something that we've not submitted to you at all on our budgets?
Yeah.
Okay.
So, and especially like a new contract or new positions or a new scope of work.
Jeff?
So, Christy, yes.
Sorry, I don't want to interrupt you. And I know Stacy, I've worked with her on some too. For those of you who don't know me, I'm the GMO on this. The prior approval requirements remain in place if it's the COVID funding or the core funding. So still, if you're requesting new equipment or anything of that nature with the COVID funds, you still have the prior approval requirements are fully in place.
Thank you, Christy.
Yeah.
All right. So feel free to reach out to your project officer or to me, and we will do our best to answer your questions. So I want to introduce our new TA providers. This is from the Support Technical Assistance and Opportunities for Program Policy and Communication to Prevent STDs, known as Stop STDs, because it takes a couple of breaths to say that. This was competed this year and awarded in the fall, and the awardees are JSI and New Insights for Sexual Health, or NISH, at Child Trends. Just a little background. JSI is a global public health organization dedicated to promoting health equity and improving the health of individuals and communities. And since 1978, JSI has provided services and support across a wide range of content areas, including STI prevention, to build capacity and strengthen public health, healthcare, and related systems in the US and around the world. JSI works in collaboration with funders, partners, community members, and other key stakeholders to develop flexible, innovative, scalable, and sustainable solutions to complex public health problems and to build health equity. And Child Trends is an organization focused on improving the lives and well-being of young people through equity-centered research. Their expertise entails a wide range of fields, including but not limited to youth development and sexual and reproductive health. This specific project at Child Trends is called New Insights for Sexual Health, or NISH, and aims to support PHCD recipients to develop or strengthen non-stigmatizing, discrimination-free, culturally competent STI services by promoting health equity practices. Additionally, their focus is on reaching those who have been historically less served by the healthcare system through increased knowledge, access, and trust building. And just a little bit before I turn it over to JSI, but we have two, because we had two really good applications who scored similarly, and we have differentiated them a little bit. That Child Trends is really focused on equity, especially focused on equity and on youth, and JSI is a little bit more comprehensive in their TA plan. So I'm going to turn it over to them, and how do I stop sharing? There. And let JSI take it away.
Good afternoon. Thanks so much for that introduction. And as Jeff just said, JSI is one of two technical assistance and capacity builders for the Stop STDs, NOFO. And we're really happy to be here today to tell you a bit more about the work that we plan to do and the TA that we plan to offer over the next 5 years. So just a little bit about our team. My name is Michelle Dawson, and I'm the project director and technical assistance lead for JSI's Stop STDs Component C work. I'm joined here today by our senior advisor, Gretchen Weiss, and also on today's call and shown here on the screen are our wonderful team members, Celicia Boykin, Mbasi Jake Juth, Jas Florentino, and Ciara Peterkin. And our team members bring expertise in training and capacity building, as well as direct experience working in state and local health department STI programs. And we're so looking forward to working with you over the next 5 years. We want to take a moment to tell you a bit about JSI. JSI is a mission-driven public health organization that for the last 45 years has been dedicated to improving people's lives around the world through greater health, education, and socioeconomic equity for individuals and communities, and to providing an environment where people of passion can pursue this cause. And we are a global organization with 3 divisions, domestic, international, and world education. JSI's domestic division, our health services division, has about 280 staff and does work in all 50 states, the District of Columbia, Puerto Rico, and the US Virgin Islands across a variety of technical areas, including HIV, STIs, and viral hepatitis. Also reproductive health, substance use and mental health, primary care, public health programming and infrastructure, and more. And through, though we work in a number of domains, our core services include capacity building and technical assistance, applied research and evaluation, policy development and implementation, and stakeholder engagement, planning, and facilitation. JSI prioritizes health equity and racial justice in pursuit of effective approaches to STI and HIV prevention, care, and treatment for priority populations. We scale up and tailor strategies that advance the goal of addressing the syndemic of HIV, STIs, viral hepatitis, and substance use disorders. achieve national goals related to STIs and HIV, and respond to the broader health and social services landscape. And so shifting a bit from JSI's portfolio of work in STI and other infectious diseases, we'd like to take a little bit of time to talk kind of a bit about the Stop STDs NOFO. The purpose of the Stop STDs funding is to support strategic opportunities to provide technical assistance to STD and HIV public health programs on systems, policy, and communication, stakeholder engagement, pilot and emerging STD program projects, and leadership education to advance national STD prevention objectives. And activities under this NOFO will include disseminating guidance and tools, educating decision makers, and coordinating with other public health programs such as HIV, maternal and child health, and reproductive health. And the Stop STDs NOFO funds 5 components, which you see here, to support public health STD programs, partnerships and communication, policy, academy, and technical assistance capacity building, component C, and special projects and program director and leadership academy. And JSI and NISHA Child Trends, who you'll hear from in a little bit, are funded for component C, technical assistance and capacity building. And providing technical assistance and building capacity are critical components of CDC program to support the 59 recipients of the CDC STD PEACH NOFO. And through these activities, we support STD staff to assess, manage, and improve their prevention and control programs and increase adoption of more efficient and effective approaches to STD surveillance, prevention, and control programs, and equitable resource allocation among STD programs. So JSI's goal as a provider of capacity building technical assistance services is to provide a robust menu of appropriate and timely capacity building technical assistance to STD PHCD recipients in support of the goals of the National STD Prevention Program. We're really honored to support you in your work and are really looking forward to working with you over the next 5 years. The primary audience for our capacity building technical assistance activities through the Stop STDs NOFO is the STD PHCD recipients, with a secondary audience of PHCD subrecipients and other local health departments. We also recognize that STI prevention and treatment happens in a constellation of different places, including community health centers, Title X family planning programs, private practice offices, and community-based organizations, among others. And we recognize that these organizations share a mutual commitment to prevention and treatment of STIs, and will endeavor to support this tertiary audience as well. So to achieve our capacity building technical assistance goals for these audiences, JSI is going to undertake 4 major activities throughout the project period. Our technical assistance activities will begin with a period of needs assessment, endeavoring to deepen our understanding of the existing landscape of TA and capacity building needs of the STI workforce to inform the prioritization of TA in alignment with the component C goals. We're currently in the process of completing an environmental scan, which will be followed by a series of key informant interviews and focus groups, as well as a survey of the STD PHCD grantees in order to gain a nuanced understanding of the needs of our audience in terms of topics and type of technical assistance needed. Additionally, and towards the end of today's presentation, we're going to be asking some questions to really start understanding your needs and what you want to see from this TBA, and how we, that is JSI and NISHA Child Trends, can best support you. Starting in the spring, and based on our experience working with health departments in the STI and infectious disease space and using the results of the needs assessment, JSI will offer capacity building technical assistance and will offer TA on a variety of topics. We recognize that different topics lend themselves best to different types of technical assistance, and we're going to endeavor to provide different types of TA over the project period, trying to ensure that we're going beyond awareness raising or knowledge building activities, but really supporting you to integrate sustainable changes into your organizations by elevating and amplifying the experiences of peer organizations. We'll communicate with you regularly throughout the project period to ensure that you're aware of TA opportunities available to you from JSI, as well as other organizations funded by Stop STDs, including NISHA Child Trends, as well as relevant opportunities from other organizations. And on the final slide of our presentation, you'll We'll share our email address so that you can contact us with any questions or recommendations for the TA that you'd like to see, and you can always reach out to us directly. And of course, we always strive to provide technical assistance that's effective and meets your evolving needs. So throughout the project period, JSI will continue to assess needs and conduct evaluation of our TA to facilitate that quality improvement. So over the next 5 years, we'll be disseminating relevant policies, guidelines, tools, and training curricula to support non-stigmatizing, discrimination-free, and culturally competent STI care. We'll be monitoring, evaluating, facilitating, and supporting management of learning communities and other technical assistance or capacity building activities. We'll be facilitating and evaluating peer-to-peer technical assistance for recipients. We'll be providing support for learning communities and communities of practice and identifying and documenting STD program success stories. We'll be providing training and technical support to jurisdictions to address disparities in access to quality sexual health services. And we'll be helping to establish and maintain a DIS registry and participate in efforts to certify the DIS workforce. So over the next 5 years, JSI is going to offer TA on a variety of topics that are going to support your health department in implementing the priority strategies and activities from the STD PHCD NOFO, including conducting STI surveillance, responding to STD-related outbreaks, identifying people with STIs and linking them and their partners to care and to treatment through targeted disease investigation and intervention. Promoting CDC recommended screenings, diagnosis, and treatment practices, disseminating local data and information to the healthcare community and general public, monitoring and developing STI-related policy, developing and strengthening multi-sector partnerships to support STI prevention and control, supporting HIV prevention goals and collaborating with health department HIV programs, and analyzing and using data for program insights and program improvement. We'll do this through TA activities, including webinars, learning collaboratives, identification of best and promising practices, amplification of training opportunities from other places, project newsletter, and among other things. And 5 years is a long time, and we intend to remain nimble and responsive to evolving and emerging needs throughout that 5-year period. JSI recognizes that STI prevention, treatment, and control requires close working relationships and a high degree of collaboration and coordination across programs and initiatives. We're committed to working in close collaboration with CDC's Division of STD Prevention, Initiate Child Trends, our Stop STDs componency partner, and all the other organizations funded through the Stop STDs Cooperative Agreement, and other training and technical assistance centers and organizations supported by DSTDP. We'll also draw upon and leverage JSI's related work with health departments, health centers, and community partners in support of this work. Projects such as our work with the CDC to expand the disease intervention training, our Integrated HIV Prevention and Care Technical Assistance Center with HRSA, the Reproductive Health National Training Center through OPA, and the BIPIC Workforce Wellbeing Technical Assistance Project will all inform our work and provide insights and strategies to support the STI workforce. And we want to know how we can best support you. So please email us at stopstds@jsi.com to learn about upcoming TA opportunities, to share best promising or exemplary practices at your health department, to share technical assistance or capacity building needs, or to ask us a question. We look forward to hearing from you. And as we noted on the previous slide, in the coming months, we're going to launch a newsletter to keep you informed of TA opportunities and other relevant information. And in the meantime, we encourage you to reach out to us, and we look forward to connecting with you in the new year as we continue our needs assessment efforts. Thanks so much. Again, please feel free to reach out to us at stopstds@jsi.com or to me at Michelle_Dawson@jsi.com, and we'll hand it right over to Nisha Child Trends. Thank you.
Thanks so much, Michelle, for that great overview.
Jen, can we
Yeah.
stop for just a second? There's a question in the chat for JSI, and I thought maybe we'd go ahead and can address it. What is JSI's background in working with frontier populations?
Certainly, we do work across the country, and much of our work does focus in frontier populations. We have offices out west that sort of enable us to really understand both from like a lived experience perspective and really doing the work in those places as well. And so we certainly have that expertise to draw in and will inform our work as we're developing TA for you over the next 5 years.
Great. Other questions, immediate questions? I know that we can also take questions at the end. I
Right.
also want to make sure that we leave some time to hear from all of you as well in the discussion period. Emma's going to bring up our slides. And as we do so, again, I just wanted to thank Michelle and Gretchen for that great overview to really set us up about, and orient us about the work that we're about to embark on in the next 5 years. Just to introduce myself, I am Jen Rogers. I use she, her pronouns. I am the Senior Director of Sexual and Reproductive Health at Child Trends. And for this project, I'm the overall project director. We're so pleased to be collaborating with JSI and of course with CDC to provide training and technical assistance that really meets your needs and that can help you improve sexual health and well-being overall. Before we get into introducing ourselves more specifically and new insights in sexual health or niche at Child Trends in more depth, I just want to take a moment to tell you why we're passionate about this work and about addressing health equity, and why we're motivated to support you as you navigate sort of the day-to-day realities of ensuring those with the most needs are prioritized, which is where our priority is. So this slide is a real simple, but I think sobering fact that you are all very well aware of, that 1 in 5 people in the US have an STI. And on the next slide, I think we want to draw your attention to, even more so, 46% of new STI diagnoses are among adolescents and young adults aged 15 through 24. So as Hannah is about, my coworker Hannah will tell you in more detail, Child Trends' mission is to really promote the well-being of youth and young adults and to really identify those young people who are overlooked, who are intentionally left out, who are ill-served by public systems. So thus, we are really committed to improving the sexual and reproductive health of this population using a health equity lens. And as Jeff sort of laid out in the beginning, our focus really will be on providing that health equity lens as we go forward. If you take a look at the next slide, I want to ground us in some of the work. We know that STIs, and especially the burden of STIs, falls most heavily on a number of specific subpopulations. So of course, I've already mentioned adolescents and young adults, but also marginalized racial and ethnic groups, those who are experiencing incarceration or homelessness, and those who are LGBTQIA+. So as I set the groundwork for the rest of the presentation, I'm going to now turn it over to Hannah to introduce our team and our approach to training and technical assistance. Hannah.
Thank you, Jen. It's so great to be here with you all. And thank you, Jen, for that brief grounding and how we're thinking about equity and our focus on those work. I'm Hannah Lantos. I use she, her pronouns, and I'm the Deputy Project Director for this project for Component C. I'm a senior scientist in our sexual and reproductive health research area and also in our youth development area. And I'm very excited to get to know all of you and how you're thinking about health equity in this year and building our work in the years to come. Before I go on to describe a little bit more about Child Trends' expertise and what we bring to this work, I want to give you a chance to hear from each of the folks on our team who will introduce themselves quickly. So you already heard from Jen, I'm Hannah, and then I will pass it on to the last 3 people on our team. Ellie, if you want to go first.
Hello, everyone. I'm Ellie. I am a research assistant in the Sexual and Reproductive Health Department at Child Trends. And for this project, I will be, my role is a project manager, and I'm excited to be here. Catherine, if you want to go next.
Sure. I'm Catherine. I use they and she pronouns. I am a senior research analyst at Child Trends, and I'm in the Sexual and Reproductive Health Department, and I'm very excited to meet you all. Emma?
Hi all, I'm Emma Pritzkin. I use she, her pronouns, and I'm a research scientist in child trends, sexual and reproductive health research area as well. And for this project, I'll be acting as the evaluation lead.
Thank you all. Next slide, Emma. So JSI already did their overview and they did an excellent job of summarizing the different components of this NOFO and of component C. And they are really your resource for your broader TA needs. The niche team at Child Trends has a narrower task or narrower focus on this contract, which is to support all of you, the PHCD recipients, in two specific ways. First, to support your work to improve health and well-being for all of your targeted recipients. Or two, if you are already focused on health equity, to provide resources and supports that can help you think about ways to increase the effectiveness of that work. So why are we the right people to help with this? As Jen described earlier, and as we know you all are abundantly familiar with, addressing disparities requires understanding and addressing the structural and social determinants of health. Understanding how environments and competing demands affect behaviors and opportunities for health-seeking behavior can impact whether people know about services, utilize services, adhere to medical recommendations, ask appropriate and needed questions from their providers, and more. Our team comes to this work with expertise in health equity, adolescent development, sexual health services in both schools and clinics, whole person holistic health frameworks, and engaging adolescents and young adults. The population, as we discussed earlier, is most burdened by STIs. We also have expertise of reaching out to those from communities that have not been adequately served by the healthcare system or have been either directly or indirectly harmed by it. Let me pass it on to Catherine now, who will briefly describe how we're going to do this, what we will provide.
Thanks, Hannah. I'd like to shift slightly and talk more specifically about the technical assistance we can provide. So first, we center equity in our work and contribute to capacity building through disseminating a variety of resources, such as written materials, webinars, or peer learning opportunities. We want these resources to be accessible and as useful as possible, and so we'll use a variety of methods, including group learning and coaching. Second, we tailor our TA needs to the needs of your organization and community and build on the strengths that you and your colleagues already have. Third, we take a systemic approach to problem solving, identifying root causes of issues and investigating multidisciplinary solutions to common questions. And finally, we engage in a process of self-reflection to locate ourselves within the work we do and consider how our experiences and identities are related to systems of power and privilege. We especially value lived experience and consult community members for their valuable expertise. And as was shared earlier, we welcome any questions or concerns you may have and look forward to assisting you. We've set up the email on the screen for questions, concerns, ideas, or requests specifically related to this project. Please email us at niche@childtrends.org. And now I'll pass it on to Emma, who's going to facilitate a broader discussion with all of you to help us understand your needs and preferences around TA both broadly and health equity specifically.
Great, thanks so much. I'm going to shift us to a little bit of an interactive discussion to get us started talking about what kind of TA topics you all want to focus on and how we can best deliver TA to you. So the next couple slides have information that'll allow you to answer a couple questions that we have via Poll Everywhere and Padlet to start us getting thinking about what work we're going to do with you guys. So start, we have a multi-choice sort of question for you guys to help us better understand modality for our TA work. And by either scanning the QR code on the screen or by going to the website bit.ly/TA_intro_1, I'm going to ask you to answer the question, I learn best when. And we've got a couple options there for you to select from. I believe you should be able to select multiple choices or answer the question multiple times. So if there are multiple modalities that you use to learn information, feel free to go back in and answer the question again. And if you're having any difficulty, please, raise your hand or say in the chat if you're having difficulty answering the question. And let me stop sharing for a second so I can make sure that this is accessible for you all. And then I'll share my screen so you can start seeing the results. And yes, in the meantime, are people having difficulty getting into this survey? Sorry, 1 second, all. Okay. Hey guys, we'll get this going in just 1 second. Okay, activate. Okay. Are folks able to get to the question?
It briefly showed the question to me, and then it's back to waiting for Emma Plishkin's. There it is. There it
Okay,
is.
great.
Yeah.
Sorry about that all. Thank you so much. Let me get this up. So you can see your responses as they roll in.
It disappeared again.
Oh man. Okay.
There it
All right.
is.
Thank you guys. Thanks for bearing with me. Okay. All right. So I'm seeing a lot of people like engaging in discussion with their peers, which in this case is you all. So I'm excited to set up opportunities and spaces for you guys to learn from each other and share best practices as a community. And then I'm seeing a lot of folks like receiving visual guides and resources. So thinking about infographics, thinking about data visualizations, and maybe some written information. Awesome. Okay. I'm gonna pause the sharing, and then the next question that we wanted all your feedback on. The next question is via Padlet, which functions very similarly to a Jamboard. And to the Padlet, you can again scan this QR code or go to the page bit.ly/TA_intro_3. And I'll share my screen with that Padlet in a second. But it functions very similarly to a Jamboard. You can add posts with your thoughts, and particularly what we want to know is what STI topics might you most want us to focus on in providing TA support. So again, put in the chat if you're having any difficulty accessing the Padlet, and I'll share my screen with that Padlet in a second so we can all see what folks are saying. And again, we're answering the question, what STI topics do you most want us to focus on? And so far I'm seeing congenital syphilis prevention. As you start seeing other people's responses pop up, you can thumbs up or thumbs down people's comments. If because we're all in community together. Maybe let's thumbs up the comments that you like and that you're voting up. And then add in your own thoughts. I'm seeing a lot here of congenital syphilis. People are really focused on supporting work at the intersection of STIs and maternal and child health, it seems. I'm seeing the social determinants of health, housing, employment, and food insecurity. I'm seeing a full particular populations and communities pulled out, thinking about incarcerated folks, thinking about migrants and working on the border, thinking about women of childbearing age, really thinking about congenital syphilis. Let's see, the workforce and pandemic approaches to STI prevention. Let's see. I'm really interested in this street medicine, jail, and ED interventions. Is there anyone who wants to come unmute and sort of expand on what they're saying? I'd love to know more about this inclusive prevention and marketing materials. Any more details around sort of what inclusion looks like in those materials? What's missing right now that you want to see?
Hi, this is Hannah from Alaska. I was the one who put that up there. I think this is just an ongoing kind of challenge in different jurisdictions that are perhaps more conservative. So we get a lot of pushback on like what's out there and what's provided, and we don't necessarily have access to internal resources that can provide these resources and materials. So like already established materials that really speak to like everyone in the population, have different people on those that look different. I think it's sometimes hard to find like brochures, pamphlets, flyers that have information that are readily available for patients or even providers that are inclusive of LGBTQ plus populations, Alaska Native populations, and so.
Gotcha. Yeah, thank you so much for expanding on that. Let's see. I'm seeing also several posts about DIS trainings, supervisor training materials, the DIS workforce certification. Getting a lot of thumbs up on these specific posts. Would anyone who posted anything about DIS training or like those posts want to come off mute and expand a little bit on what you'd like to see there? Maybe not, and that's okay. And we'll find out more information as we get closer to working with you all and really sort of dig into your specific needs. But I'm looking at all these topics that you guys are interested in. I'm really excited to start digging into some of this work with you all. I think we might have time for one last question. So I'm gonna stop my share one more time and pull up our last question here. Again, this is another Padlet, and what I'm gonna ask you to react to is answer the question, what practices you want your STI program to adopt, specifically related to health equity. And so to get to this Padlet, you can scan the QR code with your phone or go to bit.ly/TA_intro_2. So I'm gonna keep this QR code up for a second, so you all can scan it and get to the Padlet. And then I'll share my screen so we can see what we're all working on or what we're all thinking about. So this is, again, the question is, what practices do you want your program to adopt specifically to enhance health equity? Let me get at this Padlet. We can see what we are thinking about. I'm not seeing any posts yet, but I'm seeing that people are joining. And share. And feel free to put in the chat or raise your hand if you're having any difficulty accessing this Padlet. I can see that people are here. And maybe just writing some really nuanced thoughts. If you would prefer to, feel free to come off mute and share some ideas verbally. Okay, I'm starting to see some pop up. And again, as you see these ideas pop up, feel free to thumbs up the posts that really reflect what you're interested in and what you want to see. Okay. So I'm seeing some community inclusiveness, including community voices in program design, some targeted staffing to reflect community makeup. I'm seeing a couple posts on syndemic approaches, couple posts on access, virtual access to specific treatments, and testing. Looks like some information on equity-centered conversations with people who have STIs, and generally like really community-focused relationships, systematic data collection. Yeah, community engagement, community building, community representation, involving community members as key decision makers, understanding how different populations want their needs met and meeting them. That's awesome. Let's see. I'm seeing the most thumbs up on some syndemic approaches, and then on targeted staffing. Would anyone like to come off mute and say a little bit more about what you'd like to see there? That's okay. Okay, let's see. Yeah, okay. I'm really excited to dig into a lot of these topics with you guys, and we'll have these posts shared or saved so that we can refer back to them and make sure that as we're starting, we're thinking about specifically your focused interests. So I'm going to stop sharing my screen now and pass it back to Jeff and give him the last word. But thank you so much for that interactive engagement. That was exciting for us, and will hopefully be really helpful as we get started working with you all.
Just a moment to say thank you to both JSI and Nish at Child Trends. We're excited to have you on board and going on this new endeavor. I also want to thank everybody for your participation, and I also thank you for your patience with us around the budget stuff. But mostly I'm really excited about TA provision and getting a new take on it. We'll be sharing sharing it out. And Hannah, I do think it would be helpful to share those links out so people can see those Padlets. We'll put together a package to share with everybody, and it'll have the slides from the various groups, as well as we do our recording, and InPin will post it to their YouTube page, and we'll get a link to that and share it with you as soon as we do. Thanks, everyone. And that is it for our December call. Everyone have safe and happy holidays, and we'll be talking to you soon.